Bismillahirrahmanirrahim. Excellencies, ladies and gentlemen, Assalamu alaikum and good morning. Thank you for inviting me to speak. This is one of my last official engagements as First Lady, and I'm very pleased that I get to talk about a topic that is close to my heart. One of the basic principles of mental health is that of acknowledgement. Acknowledgement that mental health is as central to a person's well-being as their physical health. In fact, we now know that they are often connected. But the days when we only spoke of mental health in hushed tones, or when symptoms and conditions were dismissed as simply madness and treatment options limited to medication, sedation, and confinement are not that far in past. There are still far too many people who suffer in silence and are unable to access the support and care they need. Acknowledging the importance of mental health allows us to talk about it more freely, reduces stigma, and seek help when we need it. It compels us as a society to demand policymakers, health practitioners, and individuals to take mental health seriously. It pushes us to advocate and lobby for the establishment and increase of infrastructure, system change, and technical capacity that caters to supporting people undergoing mental health issues. Acknowledgement of mental health insists we look beyond one-dimensional narratives of tired young mothers, hormonal women, angry teenagers, and stoic men to really ask how people are feeling and offer support when they most need it. Acknowledgement of mental health allows us to better understand our loved ones and most vulnerable people in our society. Most importantly, it is the first step to helping someone navigate their way to a fulfilled life. This conference is testament to how far the issue of mental health has come in this country. For that, I would like to congratulate and thank the organizers for your unwavering commitment to develop mental health support in the Maldives. The theme of this conference is very timely: changing currents, forming connections. The world is constantly in a state of change and transition. We cannot always control how things play out, but we can work on how to respond. The strength of our responses depends on political will, data, capacity, and collaboration. In this context, I would like to highlight the work that has been done by this government. Without a doubt, the political will to prioritize mental health has never been higher in the Maldives. This political will has translated to the establishment of the National Center for Mental Health, led the setup of inpatient psychiatry services, expanded Asanda coverage for therapeutic services, promoted physical fitness and sports as part of a healthy lifestyle, increased mental health gap training, ensured higher education scholarships in the field of mental health, and increased mental health services outside of the greater Malay area. These commitments have also meant a greater visibility of the importance of mental health in the society. As a result, we have seen the start of national communication and awareness campaigns targeting youth, specialized services during times of trauma, such as during the COVID-19 pandemic. I would also like to highlight a success, the inclusion of mental health. I would also like to highlight as a success the inclusion of mental health policies in political party manifestos in the recent presidential election. This kind of public acceptance of the importance of mental health is significant in bridging the gap between demand and services, which brings me on to the importance of data. Much of the data we currently have about mental health in the Maldives is minimal and outdated. We know through different studies throughout the years that there is a rise in people suffering from mental health issues and disorders, and that approximately 1 in 5 people say they experience anxiety and or depression. Globally, we know a greater percentage of women experience mental health issues. We know of the stigma experienced by those with disabilities and those with substance abuse problems. We know the adolescents now are prone to anxiety and mental health issues, and that the context they live in post-COVID-19 lockdowns, disruptions to school, and the complications of social media must be taken into consideration. If we wish to address the issue of prevention and support, we need data to be able to identify the times and places where intervention is most effective. For instance, with young people, we need additional awareness and communication about mental health in schools, to invite them to speak up and seek help, to ensure that educators have the skills to identify young people who are struggling and guide them to additional support. We have made progress, but there is much, much more to do. We need to significantly increase the capacity of mental health support in the country. We need greater investment in early identification, prevention, and decentralization access to services. We are a small country with close-knit communities, which results in unique issues of service delivery. Legislation and systems must be strengthened to ensure that mental health practitioners are held accountable and the rights of those seeking confidential care upheld. I would again like to highlight the importance of forming connections. Connecting, collaborating, and learning from one another is something I think every society must do. But I also believe it is more critical in a small island state like ours. In my role as a mother, educator, sister, aunt, niece, a friend, and First Lady, I have had the privilege of meeting and talking to many Maldivians. They have come to me with their opinions, requests, and concerns. Even though I may not always be able to solve all their problems, the mere fact of listening, to hear someone out, has been a powerful form of connection. Connecting with others locally and abroad allows us for a sharing of information, experiences, best practices, aid, scholarships, and steady medical supply chains, to name a few. I've always believed greater collaboration is needed in the Maldives to overcome issues of limited resources and to limit duplication. Coordinated programs such as IBAMA, which brings different service providers such as police, social workers, schools, and local councils to one table are extremely effective in identifying vulnerable individuals in society and offering them support before it gets to a point of crisis. We must continue to build on these important networks of support. As I mentioned at the beginning, the issue of mental health is something close to my heart. I know how difficult it is to see those close to you suffer. I know the impact of it on caregivers. I know the dramatic difference having access to care and support means in a young person's life. I know what it means for a country to go through trauma and how important reconciliation, coping with mental health, and healing are to families and nations. Even though the political currents are changing, I hope connections we've formed around the importance of mental health continue to strengthen. I wish you all a very successful conference and assure you of my constant support. Thank you.